Some of the newer advances in diabetes are the newer medications that we've developed as we've learned more about the pathophysiology of diabetes, particularly the effect of hormones and the changes in hormones associated with diabetes. One of my favorite medications right now are the GLP-1 agonists, and these medications come in weekly formulations and daily formulations. They're actually injectables, and they work by increasing satiety, and they do this because they delay nutrient absorption. They increase insulin levels in the presence of glucose only. So if a patient does not eat, they do not become hypoglycemic, which tends to be the case with other medications. By increasing satiety, in turn, this also helps with weight loss as well. So the effect you get is lower glucose levels, and the side effect is weight loss. And right now, they're using these medications for weight loss alone. So I really like the GLP-1 agonists. In the past, we've had the following issue. A person gains weight, and as a result, they develop diabetes. We tell a patient, well, you need to lose weight in order to control the diabetes, yet the medicines we give, particularly medicines such as insulin injections and sulfonylureas, which help secrete more insulin, those promote more weight gain. So we make it harder for the patient. We're telling them to lose the weight, yet we're giving them medications that make it harder for them. Recently, with these medications, the only part that patients don't like is the injection, but the needles are very small, and the weekly injectables are easier and promote more compliance. But I've seen patients lose up to 10 pounds, 15 pounds, and have better glycemic control. Over what period of time? It depends. They can lose the weight in 3 months, 6 months, a year. But it's gradual weight gain, but it's best that they're going down. Usually these patients are up 10 pounds at the end of the year, or 20 pounds. These patients will either stay weight neutral or lose a couple of pounds. These drugs are just therapy. So we usually start the medication, and if the patient, let's say, they develop A1Cs within the target range of 7 or less, sometimes we can stop the medication for a while and see how they do. But usually you start them, and it depends. So it could be maintenance, it could be temporary. Well, the best way to lower type 2 diabetes was actually studied in this large trial called the Diabetes Prevention Program. And this study looked at over 3,000 participants, and we saw how can we prevent diabetes progressions in patients who were overweight and had prediabetes. And it turns out that even with modest weight loss, as little as 5 to 7% of total body weight, these patients either delayed progression to diabetes or completely prevented diabetes. Sleep can definitely impact somebody's risk of getting diabetes in several ways. The pathophysiology behind this was actually studied in a very small trial done on 19 men. And it turns out that men that slept less than 4 hours a night had higher levels of fatty acid in the morning as well as insulin in the morning. And this is what we see in the early stages of diabetes. In the same note, a person who's not sleeping an adequate amount of time, usually 7 to 8 hours at night, tends to wake up more tired. In turn, this leads to more fatigue and decrease in physical activity. And if a person stays up late at night, they tend to snack more, so that adds to the calories in their day. Based on this large trial that I just discussed, the Diabetes Prevention Program, it turns out that increasing physical activity and diet and exercise is what you need to maintain your weight and losing weight. So weight control is really the best way to prevent diabetes. We've noticed in the United States over the past couple of years that as the obesity epidemic took over, so did diabetes. So they definitely go hand in hand. Eating healthy, basically trying to eat foods that are not as processed. My advice to patients, try to eat something that will eventually spoil in your shelf if you don't eat it within the week. So those foods tend to be more natural. They tend to be your fruits and your vegetables. The tips I give to patients for exercise is as follows. Usually I tell patients, try to increase your overall physical activity. If you don't have time to do a formal exercise regimen, we usually recommend 30 minutes a day, 5 times a week. Just increase your overall mobility. And you can do that by either taking the stairs instead of the elevators, parking your car a little bit farther, and walking more. If you're watching TV, make it a point to stand in between commercials and walk around. I just recommend a lot of mobility. If you're at your desk, make it a point, put a timer every hour, every 2 hours, stand up, go to the bathroom, go to the pantry, walk outside. Overall, just walking and tracking footsteps as well. There's a lot of tracking devices we have now on our phones, pedometers that you can buy just to be more aware of what you're doing. It is working for my patients because particularly putting the timer on their phone. I'll have them every hour, every 2 hours, every put an alarm. And when that alarm goes off, make sure you do something, at least for 2 minutes. So that helps them become more aware.